So to start with today, I'm just going to talk about the general principles behind exercise training that apply to everybody, not just people with Fontan. The main goal of exercise training is to cause adaptation, be that structural to make the muscles bigger or functional to make things more efficient, so the extraction of oxygen from the blood. And the way that you do this is through the principle of overload, where you place stress upon the system, which makes it change. And how you do this is by increasing the frequency, so that's how often you do things. So if you exercise twice a week, increasing that to 3 times a week. By increasing the intensity, so say you lift a 10 kilogram weight, increasing that to 15 kilograms, all the time. So if you go for a 20-minute jog, going for a 30-minute jog. And that brings us to the principle of specificity, which refers to you need to train the muscles that you want to use. So what we know in people with Fontan, that their leg muscles are very, very important. So by doing exercises which strengthen their leg muscles, they will get the most benefit. Before people start an exercise program, it's very important to know that everyone's different. Holly obviously can run and exercise at a very high level. Some people, though, they can only start out with a brisk walk, and that's fine. And it's very important to take this into consideration and prescribe exercises to the person and to the individual. And in terms of reversibility, this just refers to the fact that if you don't use it, you lose it. So if you stop exercising, most of the benefits that you gain, you will lose. So before I start to talk about exercise in Fontan, I'd just like to mention safety. So over 200 people with Fontans have taken part in exercise training programs in the literature, and there were no adverse events in any of them. So we do know that exercise training is safe. And in terms of weight training, we just recommend that children under 15 don't start using weights, but after they're 15, in a supervised program, they can start weight training. And before you start an exercise training program, you should discuss it with your cardiologist, because there might be some specific restrictions placed upon you depending on the medications that you're on or if you have an abnormal heart rhythm. So I know this is a bit of a busy slide, but I just want you to focus on this section here. From research, we know that the main reason that people with a Fontan circulation's ability to exercise is reduced is because they're unable to increase the amount of blood that's pumped by their heart. So how is blood pumped by the heart? Quite a few of the speakers have mentioned this already today, so I'll just cover it briefly. But a person with an extracardiac Fontan has a single pumping chamber, and the blood flows back to the heart passively through the lungs, and this chamber pumps blood to the rest of the body. And the muscle pump, though, is something that we seek to train in exercise. In your legs, you have a lot of blood vessels where blood pools, and when your leg muscles contract, you squeeze the blood back up towards the heart. And so by strengthening the leg muscles, we can strengthen this pump and make more blood flow back to the heart. And then coming to the lungs. If I can get all of you to take a nice big deep breath in now. As you feel your lungs expand, as you suck in the air, you're not just sucking in oxygen, but you're also sucking blood back into your lungs. And this helps increase the amount of blood returning to your heart. So what types of exercises... You okay, Karen? You can breathe out now. In terms of the types of exercise, we really broadly have 2 types of exercise: cardio exercise or endurance, and then resistance training. Now, each of these train different parts of your body and have different effects. In terms of endurance-based exercise, what we know from people with normal hearts is that an exercise program leads to increased amount of body then more blood can be pumped by the heart. We also know that the muscles get better at extracting oxygen and using energy supplies in your body. In terms of resistance training, as I touched on before, the muscle pump, if you strengthen your muscles, you improve the muscle pump. The muscles get bigger, so you can improve the muscle pump. We also know that the nerves which interact with the muscles, that connection improves. Turning to the muscle groups now, we know that in people with normal hearts, we know that arm exercises, weight-based exercises, actually increases strain on the heart, which is why it's quite important to mainly focus on leg-based exercises if you're doing a weight-based training. So turning to types of sports, so you guys have a better picture of where sports fit in. As everyone knows, golf is quite a sedentary activity, and so it's quite a low resistance and a low cardio and doesn't put a lot of stress on the system, right through to squash, which is very high intensity and lots of short sprints, so it's quite strenuous and tough. Weightlifting doesn't really get your heart, doesn't get you out of breath, but it places a lot of stress on your muscular system. And finally to rowing, which is a bit of a combination of both. So, children are a little bit different and adolescents are quite different to adults in terms of what sort of things you can do with them in terms of exercise training. So in children less than 6 years old, active play is really important to get your child familiar with exercising. So, active songs like Ring Around the Rosie or playing Stuck in the Mud or activities like that. As they get slightly older, they can move to team-based or individual sports like dancing or tennis or soccer, mainly focusing on fun. That exercise should be fun because we do believe it should be part of their everyday life. And once they hit this kind of adolescent age, they can start to move towards a more regimented exercise training program, which incorporates both resistance and cardio-based exercises. And obviously after 15, they can then start doing weight-based training. So how to start your child or teenager's program? It's very important that you start slowly. We know from research that if you start with a really high-intensity program, people don't tend to continue it. So doing a low or moderate-based intensity would be the way to start. It's got to be fun. You all know how hard it is to get your child or teenager to do things that they don't like to do. So it's important that they enjoy it. In terms of the intensity, we really aim at this kind of this smiley face to this smiley face kind of level where they can still talk, but they're a bit puffed out. And as I mentioned a few times already, no weights if they're less than 15. And when they do start, just to start with a low weight with high reps and a lot of supervision from someone who knows how to train children to use the correct technique and the correct breathing. So this year we conducted an exercise training program in Victoria. It was a home-based exercise training program of 8 weeks. There were 2 sessions a week, which took about 40 minutes to an hour. And what you can see here is the impact that just 8 weeks of exercise can have on someone's heart function. This oxygen consumption is a measure of the individual's exercise capacity. And what you can see is after 8 weeks of training, they've got about a 10% improvement in the amount of exercise they can do. And this graph in the red refers to the amount of blood that's pumped by their heart. And after 8 weeks of training, there's a 7% improvement in the amount of blood pumped by their heart, which really shows that a simple 8-week program can have a significant impact on your child's heart function. Perhaps more importantly to me, though, as a physio, is the impact on quality of life. The cardiologists and the cardiac surgeons all very much love how well the heart's functioning, but if your child can exercise for 10 minutes or 11 minutes, it might not make that much difference in their life. But the quality is quite important. And what we saw in our study across total score, psychosocial, emotional, and school performance, both in terms of what our participants, who were children and adolescents, and their parents, all thought there were quite large improvements in their quality of life. So some of the things that I was told by parents was, my child used to come home from school, they'd have to let rest for half an hour before they could do their homework or go outside and play. They don't need to do that anymore. They can do their homework, they can concentrate longer in class, they can pay more attention. And I think those things, and the fact that the children feel better in themselves and happier and less angry after 8 weeks of exercise, is really powerful and really stresses the importance of exercise in all people with Fontan. So really the take-home messages from the talk today is the safety. So exercise is safe in people with Fontans, but you should talk to your cardiologist before you start an exercise training program. We strongly believe that exercise should be part of the daily routine in a person with Fontan, obviously with age-appropriate exercise training. It's important to take into account your child or adolescent's individual differences. Everybody's different, and exercise should be prescribed to the level that they have. Exercise program should ideally, in younger children, have active play, and as they become older, move to incorporate both an element of cardio and resistance training, mainly focusing on strengthening their leg muscles. And what we do know, not just from the research that I conducted, but from the broad literature, is that exercise training results in improved heart function and also improved quality of life. So if you have any questions, please don't hesitate to contact me on my email address or ask at the end of the session. Do it.